Welcome to another episode of the Cruz Orthodontics podcast. Today we're talking about bonded retainers. What are they and how do they help improve your smile? Dr. Cruz, can you start by telling us what bonded retainers are and how you use them during orthodontic treatment?
Yeah, absolutely. I think that before talking about bonded retainers, it's worth talking about the two different types of retainers. The most common retainer is the removable retainer. It's the most common type of retainer that you see where patients are able to take them on and off. Um, the issue with removable retainers can be compliance. And so obviously, if you're going to invest a lot of time and money into getting your teeth perfectly straight, you want to make sure they stay that way. And that's where bonded retainers can be a huge advantage. So, bonded retainers are thin wires that we actually place and glue on behind the teeth. More often than not, it's usually behind the lower front teeth. And so having that little wire behind the teeth helps keep the teeth perfectly straight. And no longer have to worry about whether or not you're wearing your retainers and compliant with them. So they're fantastic as far as keeping things really well aligned.
And so this, would you say that's the main advantage of the bonded retainers? You don't have to worry about taking your retainer in and out?
That is by far the biggest advantage, not having to worry about wearing it. The other thing that's probably worth spending a minute or two talking about is everybody's teeth are different. We have some patients where they'll finish orthodontic treatment and they can literally get away with not having to wear a retainer ever again, and their teeth stay nice and straight. Granted, that's not very common. And then you'll have the opposite end of the spectrum where patients will get their braces or Invisalign completed and those teeth want to move immediately. And so, patients who have a really high tendency for what we call relapse, I really encourage them to have bonded retainers. It's quite common for spacing between the upper teeth. So you'll see people that'll have that little space right between their two upper front teeth. When patients have those, it's pretty common that that space wants to open back up. And so oftentimes I won't give the patients an option. I'll say, look, you're going to need this bonded retainer so you don't have to worry about spaces reopening.
How do the bonded retainers help the teeth from moving back to their original position?
It doesn't take much force or pressure to keep a tooth in the same position. And so when you actually look at the wires that we use, it's actually, if you look at it really closely in detail, it's a braided wire and it's really soft and flexible and pliable. And so you'd think to yourself, geez, how is this little wire going to keep my teeth from moving? But it's not like we're trying to actively move the teeth. What we're trying to do is just keep them in the position that they're in. So even though this wire isn't all that stiff, it's amazing how little pressure or force it takes just to keep teeth from moving. Yeah, they work really well.
So, can you tell us about certain cases where you would recommend bonded retainers over removable retainers?
There are two situations where I'm sort of more adamant with our patients that they have bonded retainers when they complete treatment. The first one is if they have severe crowding, particularly with the lower front teeth. If you stop and think about it for a second, the lower front teeth are the smallest teeth in the mouth, and they have the highest tendency for relapse. If you think about bigger teeth like the molars in the back, if they move, it oftentimes causes the lower front teeth to move even more easily. And so they're most susceptible to moving. So anybody that has lots of crowding amongst those lower front teeth, those patients, they'd say, look, this is going to be your best bet to make sure that the teeth stay nice and straight. And then the other one that I touched upon briefly is a space right between the two upper front teeth. That we call it diastema, fancy word for a space between your front teeth. And that space always wants to creep open. And so that's the second situation where I'm usually pretty firm about getting a bonded retainer.
Well, can you walk us through the typical procedure for getting bonded retainers? What does it look like?
Yeah, sure. It's quite a bit easier than it used to be. There was a time decades ago where bonded retainers used to only bond onto kind of the two side teeth on the lower. We call them the canine teeth. And then the bar would run across the lower front teeth, but it wouldn't actually have any glue holding onto those lower front teeth. and they just worked so. And now we have these really slick bonded retainer wires that we use. They're actually ribbon shaped and made of braided wire, so they sit really flush up against the teeth. I mean, you can imagine that the tongue is definitely going to notice anything that you put behind your lower front teeth. So it's important that you place something that's going to be really sleek and smooth and not be irritating to the tongue. And
Mm.
so that flat wire is really crucial towards that. And then the other thing we do is we place just a little bit of what we call flowable composite, or for lack of a better term, glue onto that wire. But we make sure that we shape that glue so that it's nice and rounded and smooth so that it feels comfortable for the patient.
Well, so how long does the bonded retainer process take in general? Is it uncomfortable for the patient while it's happening?
Oh, it's really easy. In fact, the way we do it at our office is the day, let's take a patient that has braces, for example. So the day that the patient comes in to have their braces removed, the very first thing we do is we actually place the bonded retainer before we start taking braces off. So you want to make sure that there's no opportunity for those lower front teeth to shift at all.
Mm.
So once we have that bonded retainer placed, which usually takes about 10 minutes or so, no pain, no discomfort, really easy to place. Once that's on, then we have the green light to be able to remove the braces, and we can sort of rest assured that we don't have to worry about any relapse or shifting between that time where the retainer was placed and the braces were removed.
Can you talk about what the materials are that these bonded retainers are made of? Are there different types of materials they use?
Yeah, two basic materials. Actually, years ago, the most common material was white gold, and white gold is fabulous. It's just, it's an inert metal. The price of gold has gone up over the years. I think the
Hmm.
price of gold is $2,400 an ounce now. And so what's happened
Yes.
over the last decade or so is that the material has actually shifted over to stainless steel, which is also a great material, a little bit more practical. And so the nice thing about either gold or stainless steel is that you can shape them and form them custom to the shape of the patient's teeth. So once again, it's as comfortable and sleek and smooth as it can be.
So, what type of care do you have to take when you have the bonded retainers? Are there any foods that you need to avoid?
That is a great question, and that's probably where a fair amount of discussion is worth having. So we've talked a little bit about the upsides of a bonded retainer, right? Not having to worry about wearing that removable retainer, not having to worry about your teeth shifting. But there are some considerations. One of them is the extra effort that it takes to keep a bonded retainer and the teeth that it's attached to clean. And so
Hmm.
you can imagine when you have braces on, it's a little bit more effort and work to floss. The same applies for a bonded retainer. So you do have to spend a bit more time sort of threading the floss under the retainer. In my opinion, it's worth that extra effort to keep it clean, because you're guaranteed that the teeth are going to stay nice and straight. You may come across some general dentists and you may come across some hygienists that can become a bit annoyed with having the bonded retainer just because it's a little bit more difficult to clean around it. One of the things that we consider when placing a bonded retainer is how good was the patient's oral hygiene during treatment. We don't want to set
Ah.
our patients up for failure. So, assuming they have good to excellent hygiene, they tend to be great candidates for a bonded retainer. But it is worth having that conversation with our patients that it's more effort to keep it clean. But like I said, in my mind, it's definitely worth it.
So, how often do patients have to return for checkups? Do you ever have to change the retainer?
Very rarely do we have issues. And so, if you were to bite into something really hard, ice is a common example that we talk about. There are people that like to chew on ice. That
Ah.
can pop off the glue that holds the retainer to the teeth. It doesn't happen often, but it's usually very simple to repair. Patient comes back, we add the glue back on, and they're good to go. We've had patients that have had their bonded retainer for literally decades and haven't required any sort of maintenance around it because they've done a good job of taking care of it.
Hmm.
Oftentimes, what I'll tell the younger patients, so patients that are 13 or 14 years old, sometimes it can be a bit daunting to think about having this bonded retainer in your mouth for many decades. But what I often tell them is that I at least want that bonded retainer to stay in while the wisdom teeth are still present. There's sort of this common knowledge that as wisdom teeth are developing and erupting, they can really push teeth around. And so I start to become a little bit more flexible about potentially having the bonded retainer removed once the wisdom teeth are removed, because the likelihood of relapse starts to drop a bit once those wisdom teeth are gone.
So, what are some of the most common issues you'll have with a bond or retainer over time?
The biggest issues are, and they're not common, but the biggest issues are breakage and then keeping the area clean. And so, if you're not doing a great job of keeping it clean, what you'll notice is tartar developing around the bonded retainer and around the teeth. And so that's why we do these retainer checks. So patients come in, and even though we're not necessarily adjusting the bonded retainer, I'd like to get eyes on the patient and make sure that they're doing a good job of keeping it clean so that we don't have other issues like gum disease later down the road. And so that's probably the biggest two things to consider is just keeping it clean and not biting on things that you shouldn't be biting on that would cause it to break.
Mm. All right. So, comparing bond or retainers to removable retainers, how would you compare their effectiveness to prevent relapse?
Yeah, it's sort of a slam dunk as far as effectiveness. Removable retainers have just a little bit of play between either the plastic and the teeth or the wire and the teeth. And so,
Hmm.
even with some of our patients, and it doesn't happen often, but sometimes, even with excellent compliance with the removable retainer, you can still have some relapse. That really doesn't happen with bonded retainers because it's literally bonded onto the teeth. You don't have to worry about even the slightest bit of movement, which is something that you can experience with retainers that are removable. Like I said, even if the patient is wearing them. So oftentimes you'll have to adjust the retainers to make sure that you're keeping those removable retainers holding the teeth properly. And you just don't have to do that with the bonded retainers.
All right. So, if you're comparing the two retainers, removable versus bonded, could you just go over, like, in general, the pros and cons of each?
Sure. When we talk about removable retainers, what I've noticed is compliance tends to run really high immediately after the braces or Invisalign treatment is complete.
Hmm.
But like anything in life, as time goes on, you start to get sort of tired of the process. And even having some of our patients wear those removable retainers at nighttime when they sleep can start to become a bit problematic. So, far and away, the Achilles heel with removable retainers is compliance. How well are they going to do with wearing them? Sometimes there's this misconception that I got my removable retainers, I only have to wear them full time for a few months and then I don't have to wear them ever again. And it's just not the case. Whether you have your wisdom teeth or not, your teeth are going to shift throughout life. And oftentimes our patients are sort of surprised to hear that. They didn't realize that the teeth are always on the move. And so
Yeah.
over the last, I'd say 5 years, I've just become a huge proponent of doing bonded retainers. It's not like bonded retainers are a new thing, but I was just so tired of having patients having relapse. And, our patients were starting to become upset with it as well. And so using these bonded retainers has made a huge difference as far as sort of guaranteeing that one, we're going to get you an excellent result, but two, and arguably as important, it's going to stay that way.
Hmm. Well, so if someone does have removable retainers, will they keep the dental monitoring device and just send you the images every 3 months or something? Do you do that?
Yep, I think you nailed it, Rich. That's exactly what we've been doing is that patients will do a scan every 3 months with the retainers on and then also with the retainers off, just so we can sort of do an assessment. And so, yeah, it can be a little bit daunting of like, oh my gosh, am I going to really have to do this for the rest of my life? You think about the demographics of our patients. Most of our patients are in their teens, and a year or two after their treatment is done, typically they're off to college. And that's a time in their life where there's a lot going on. And so asking a
Hmm.
patient to be really consistent and compliant with removable retainers in college is a big ask. And so that's one of the other reasons why we started to move more towards these bonded retainers.
So, what kind of feedback do you typically get from patients who are using bonded retainers?
Initially, when I present the idea to them, there's definitely some hesitation because, just trying to sort of wrap your head around having something that's going to be placed on your teeth that's going to be there for a long period of time isn't the most exciting thought. And so I'll
Hmm.
sort of talk them through it. We'll have this conversation similar to what we're having now as to why I'm a big proponent of it. And then when following up 6 months, a year, even years later, hey, how you doing? How's the bonded retainer? Is it comfortable? Is it bothering you? You'd be amazed at how many of our patients say, oh my gosh, I'm so glad that I have this. I have friends that don't have this. They've already had their teeth shift. They're having to go through treatment
Mm.
again. And so it's interesting to see consistently how often there's sort of this hesitancy about getting a bonded retainer. And then within, a few months, they've sort of embraced the idea and they're so glad they did it.
So demographic wise, are there any certain age groups that would do bonded retainers versus removable? Does that make any difference?
Generally speaking, I want all of the adult teeth to be in the mouth. And so when we're doing early phases of treatment, I tend to lean more towards removable retainers just so I can help guide the adult teeth into the mouth by taking the removable retainer out, doing adjustments to it, and kind of really helping shape the arch and allowing the teeth to erupt.
Mm.
So normally I'm reserving our bonded retainers to patients that have all of their adult teeth, which generally speaking ends up being at about age 12 or 13 on up.
Are you able to give us any idea of the cost for getting the bonded retainers? Does insurance cover any of this?
We try and keep it simple in our office. And so what we end up doing is keeping the cost of a removable retainer and the cost of a bonded retainer exactly the same. And it's always a little bit tricky answering the question about insurances because every insurance is different, but
Mm.
oftentimes insurance companies will reimburse for a retainer.
Well, Dr. Cruz, thanks for being on the show again. I definitely learned a lot, and we hope to see you soon.
Yeah, my pleasure.